Good morning, PE 46 world. This is Dolly England, Reproductive Health Access Coordinator, and we have a very special webinar today. This is our local public health authority roundtable, and I'm going to let you know right now that we have a packed agenda. In fact, we have so many things on our agenda that I'm a little bit concerned about getting through it all. And so as normal, we're going to do polls in today's webinar. If you haven't participated in a PE 46 webinar before, you are going to want to take your cell phone out, or you can participate live from the web. You're going to text RH program to 22333, or you can go on via the web to pollev.com/RH program. You will want to participate. I don't have a lot of polls today, but I need your feedback on which direction to take this webinar. So again, you're going to text RH program to 22333. This is what it'll look like via your phone, and on the right is what it would look like if you're using a web browser. Again, text RH program to 22333. or pollev.com/RH program. Okay, you all ready? Now, I'm having a complicated webinar today for you. So, in one word, what county do you represent? In one word, what county do you represent? Let us see who is on. So, Washington, Multnomah, they must have more than one person on the line. Klamath, Harney, Lane, Benton, Lynn, Coos, Crook, Umatilla, Jackson, Grant. Getting some more in here. Crook, what's going on? All right, you all are figuring out how this works. Very, very cool. And welcome to each and every one of you. Okay, I'm going to give folks just another second because we do not have time to waste today. Okay, your next poll question. I see you, Columbia and Morrow. Okay, this next question is important. The next poll question is, would you rather power through the webinar without time for questions or split this webinar into two presentations, and we're going to have the second half in February? And I will say that we do have 90 minutes for this webinar today. We have availability to stay on the phone up until noon if people want to have questions and have conversation. On your webinar handouts, you will see the questions that everyone has asked. I have attached them as a handout so you can see them all, but I was a little wrong, quite frankly, in how many of you would turn in this assignment. Everyone almost did, and we have over 177 slides. Yes?
I have a question from Charlene. Can you say how many presenters there are and how much time each?
We have 35 counties, and in 90 minutes, you would get like 2 minutes to present your slides. Some of you have done more and thus have more slides. Some of you don't. But from what I can tell from this very scientific poll is that y'all want to wait and do half of it today, and then we will do the second half in February. So that means that our February topic, which is sex education, will be bumped, and I'll make it all work. But I wanted to respect what you all want. You all want the time to talk and to get everybody's opinion. So what we will do is we will power through today's webinar, and we will stop the clock at 10:10. At 10:10, we will open it up for questions. So
can you clarify when you say power through, you mean we'll stop at 10:30 and everyone else will do February?
Yes.
Okay. And there was another question, which was from Clackamas asking if they can use early because they have to jump on another call.
Yes, Clackamas, this webinar is in alphabetical order, okay? So what we're going to do next is we're going to talk again about what it is that we asked of you. So Clackamas, you're going to be third in this. You'll be within the next 10 minutes, probably. So what we've asked of all of you is to focus, to tell us about your PE 46 work thus far. You all have done that and sent me your slides. So a little bit of etiquette for this webinar. We will present in alphabetical order. When it is your turn to present, we will unmute you. So please use the text box to ask questions and communicate with us. Allison is my webinar diva and is helping me go through all the questions that are coming through. We're going to ask that you hold all of your questions and comments for other LPHAs until the end of the webinar. At 10:10, we will stop and we will open the phone lines up for questions. And then we'll raise your hand and we'll unmute you so that you can ask those questions. So without further ado, we will go ahead and move with our first county, which is Baker. Baker, if you could, we're going to unmute you.
Nancy and Alicia are now unmuted.
Nancy and Alicia, take it away, ladies. You're unmuted.
Hello. What our plan is, we are wanting to conduct a survey to identify the barriers and gaps in our area. Some of the questions we want to ask on our survey is the age of our clients, if they like the dates and the times of our clinic, how they find transportation or if transportation is an issue to get to our clinic, what they think about the location of our clinic, because we're on the outside of town on a busy street and there are no sidewalks on the way to our clinic, and some other questions, but those are the main ones we want to focus on. And then all the people who are participate in the survey are going to be given prizes like keychains, notepads, lotion, water bottles, and then a chance to be entered into a larger drawing for gift certificates to coffee or Amazon or Target. And then, how do I get to the other slide? Okay, what we've done so far is we participated in a large adolescent wellness event. That event was over 3 nights, and there was 138 youth ranging from age 10 to 21 who participated. We had about 70 volunteers, from medical providers to nurses, physical therapists, mental health providers, and MAs who participated in that event. The people who attended, and they went from each station, they saw physical therapy for a musculoskeletal assessment, then mental health for drug and alcohol screening, depression assessments, and then they came to a nursing station for immunization assessment. And then we did relationship safety and then talked about birth control and that type of stuff, and encouraged parental involvement. And then they went to a doctor station afterwards and completed their wellness exam, sports physical, whatever they needed. And everybody who attended got a free movie pass and then a chance to enter into a drawing to win other prizes, including Amazon Fire tablet. So that was an awesome event. We were at a community health fair hosted by our local community advisory council to promote the services that our health department does, including our reproductive health program. And then we had the ability to schedule appointments for people while they were there. And then we're also working with our Safe Communities Coalition. they usually focus on teen drinking and things like that, but we're also getting them to focus more on risky behavior and safe relationships too. So that's kind of a different focus for them. Our next step is doing our survey. We were going to try to do it in the fall, but we have a nursing shortage right now. So we moved it back and we're going to do it in February. What has been awesome is there's only 7 staff here at the health department. So it's been amazing what we've been able to do with such short people. So that's what we've done.
Yay. Thank you.
Yep.
Benton, you are up.
Okay.
We are working to unmute you.
And you're unmuted. Anne is unmuted.
And you're unmuted.
I'm not sure if someone else should be or not. Anne, can you hear us?
Okay, well, we are excited to share the awesome work that Benton County has done. Their priority areas were around clinical services, supporting and creating partnerships.
I think you just unmuted me. Can you hear me now?
Yay!
Yeah.
There we go.
Perfect. Okay. We identified the following priority areas, and all of our activities and projects we wanted to tie back to these priority areas. So they were clinical services, supporting and creating partnerships, promotion of services, outreach and engagement activities. So again, all of the activities and projects we wanted to be able to tie back to those. We've been working on providing clinical services at our four of our FQHC clinic sites. We've been working to engage internal partners to support patient needs through warm handoffs, partners internally such as public health, health navigators, health promotion, and primary care.
There we go, sorry.
Can I do the slide changing? Or
I don't know, I'm not smart enough to know how to do that.
That's fine.
I'm really sorry.
That's okay. Accomplishments and focus areas, we went through a big remodel over the past year. It was actually probably more than a year it took for the Benton Health Center, which allowed for our reproductive health services to be located in close proximity to primary care, immunizations, our communicable disease program, health navigators, WIC, and the maternal child health services. And by co-locating these services, it's helped us build stronger internal relationships and build a more collaborative care model. Investing in these internal partnerships has created a more bidirectional referrals and staff dialogue between these programs. These are just pictures of our new spaces. The one area is the WIC area with the toys, and the other area is one of the primary care clinic areas. So it's created more welcoming spaces, and we're located kind of in between those areas. We've also been working on supporting community partners. We provide regular staff hours at a local pediatric clinic and teen center as part of our ongoing relationship with them. The picture you're looking at, the concrete portion of the building is the Boys and Girls Club, and the brick portion of the building was an addition that was added on. The bottom level is the teen center, and the top level is the local Samaritan Pediatric Clinic that we've been partnering with. Yep, you jumped ahead too fast on me.
Sorry.
That's okay. We've been offering community and school-based presentations on community resources, accessing services, birth control, and STI prevention. We've also been engaging in outreach to events and organizations for sharing information, promoting services. as well as exploring new partnerships, things like the Len Benton Community College, the county jail, farmers markets. We also had an open house when our remodel was completed. So challenges and next steps, we've noticed an increased apprehension within immigrant communities due to the political climate, which has decreased willingness to seek services. So that's something we're continuing to talk about. Partnership building is slow and time consuming, and it lacks clearly defined goals, so trying to sort through that. We're looking at a possible remodel and expansion at one of our other rural clinic sites, which will impact access to services short term, but will hopefully expand opportunities for services long term. I think privacy, being a large clinic in a small community, presents some privacy challenges, so that's something that we continue to work on and look at. Next steps, continue to explore partnerships and look for new ideas or ways to engage with youth in the community. Explore potential for expanded services at our rural sites. I think there's lots of opportunities there, and look for ways to engage with internal partners that are not as closely connected or co-located with this at this point, such as behavioral health. Things we're proud of, increased integration and helping clients connect with multiple resources in one location. The picture on the top is the new front of our building, which has a lot more easy access, improved parking. It's also created more warm, welcoming, modern service spaces where people can access more services in one location. We're also seeing that our partnership efforts are paying off with examples of referrals. So.
Thank you. And I just want to let folks know that I have removed everyone's question slides and I have combined them all together. So if you're wondering where your question slide was, that is what's happened to them. They have all been combined and are at the end of the webinar, or you can see them as an attachment. All right, Clackamas.
Kim and Lindsay, you are unmuted.
All right, is Lindsay there?
Yes, I'm here.
Okay, so Lindsay and I are going to tag team. So she's got the first two slides, and then I have some in the middle, and then she'll close. So go ahead, Lindsay.
Yes, thank you. So I'm Access to Care Coordinator. Sounds a little echoey. Do I sound okay?
You sound great.
Oh, okay, good. And Kim is the Access to Care Manager, and our department has those programs, the immunizations, reproductive health, WIC, and nursing home visiting, Healthy Smiles, maternal child health. And our focus for 2019-2020 was expanding the Oregon Reproductive Health Program, and we decided to focus on the 2 school-based health centers that don't provide any contraceptive methods, which is Oregon City and Sandy. And Kim is going to talk a little bit more about Oregon City in the next slides, some recent changes that are going on there. And then we want to continue to lead and support the Clackamas County Sexual Reproductive Health Coalition. And our 4 work groups focus on advocacy, access to services, shared resources, data, and research.
Great. So what we've done so far, back in 2018, we call it the Center for Public Health Advancement. It has our epidemiologists and communication specialists. They put out a paper on the rises in STIs, specifically in Clackamas County, and they were able to look at STIs by what we call health equity zone, which are loosely school district zones. And that paper got a lot of attention, and it got some media, including national media. And that really, in our community, was an impetus to start our Clackamas County Sexual and Reproductive Health Coalition. So we combined both our communicable disease team and reproductive health to co-lead this coalition. And Clackamas County is kind of the backbone organization, but we have over 40 community partners as part of our coalition. And that coalition started last January 2019. And over the last year, we've developed a work plan, which focuses on those 4 areas that Lindsay mentioned. And we have used it's called Blueprint Clackamas. It's a website for our community health improvement plan. So it's a website that community organizations and different governmental organizations can access for a variety of public health information and data. And we use that site to house all of our coalition materials, our meeting minutes, our work plan, all of that kind of stuff. Yeah, so we've done a lot of coalition work over the last year. Our epidemiologist did a reproductive health summary and looked at some of the reproductive health data by health equity zone. And our biggest thing that we've done so far is that last week, on January 13th, the Oregon City School Board voted 7-0, so unanimously, to begin dispensing contraceptives at their school-based health center. And we worked really closely with the Oregon City School Board. One of their school board members is on our coalition, and she's also a former county employee. And she was very interested in the public health impact paper, and she shared that with the school board. They invited us to present at a work session, and we shared some information that really got their attention. You can see in the slide there that we shared that the Oregon City Health Equity Zone had the highest rate of teen chlamydia in 2018 out of the 10 health equity zones in the county. And then we shared information looking at the reproductive health services that are offered across the school-based health centers in the county. And it was pretty clear that Oregon City was only doing the STI testing and screening and reproductive health counseling. They weren't offering any other services, including condoms. Next slide. So our next steps are to continue our coalition development. We want to have a better kind of organizational identity and make sure that we're kind of all on the same page in terms of vision, mission, values, and moving our work forward. We want to focus on replicating what we did in Oregon City to the Sandy School-Based Health Center. We want to expand our reproductive health assessment or summary and potentially do another public health impact paper, but this time kind of like a follow-up to the STI impact paper, and talk more about reproductive health or reproductive health justice. And we're exploring opportunities to capitalize on the Oregon City School District win. We're looking at potentially having a Board of County Commissioners reproductive health resolution modeled after Multnomah County, just ensuring having the commissioners take a stand on ensuring access to reproductive health for all residents of Clackamas County. And we want to recognize the school board and one of the school board members, Martha, who was on our coalition, as being public health champions, and really honor them for the great work of leading our coalition and making this big policy change. So what we're proud of our coalition engagement. Like I said, we have over 40 participants. We're also proud of integrating reproductive health into other areas of public health. One example is that because the way that we're structured, WIC is also under the same umbrella as reproductive health, and we've started distributing condoms at WIC, and we've also added a question to our data system about contraceptive methods and barriers to accessing reproductive health services. And we're happy that we're able to work well within our organization to co-lead the coalition. Like I said, we work with our communicable disease team, and we have we also work with our health centers, our FQHC, which is an Oregon reproductive health provider. So they're doing the clinical services, and we're doing the public health role in terms of assessing and promoting services and ensuring there's no gaps in services. And so I think we're proud of having those clear roles and responsibilities between public health and the clinical Oregon reproductive health providers. It's really helpful that we have PE 46 to help support increasing access to reproductive health services, and that it's clear that, at least in our county, the way we're structured, that public health is not the one providing the clinical services, and it's a good model for us that we are working with many other clinical partners and ensuring access, but we're not actually providing that access. That's more of a health system role. We're happy that we've been able to leverage resources to support this work. Lindsay's our P46 coordinator, and she works in many other programs. And so we're lucky that she can work across programs and we can leverage other resources. And we're proud of our county leadership support for this work. Next slide.
So the challenge, sorry, it was still a bit echoey. So challenges with our coalition is the attendance and participation. Since we do meet monthly, it can be a little bit challenging for the attendees to attend regularly. And clear coalition direction and organizational identity, like Kim mentioned, that's something that we're starting to work more on. And messaging, nexus of STIs, unplanned pregnancies, and contraceptives, and resources, finding time and more funding for our projects. And that's it.
Thank you so much, Clackamas. Next up is Clatsop.
Tracy, Buster.
Tracy.
Buster?
Yeah, but I'm not from that county. I'm from Malheur.
Sorry.
Okay, never mind. We're going to mute you again.
Yeah. Okay. Tracy Erpling, you are unmuted. And
Excellent.
Dawn. Yep.
We're in the
she's
same
unmuted.
room, so you don't specifically do anything.
Oh,
All right. Great. Perfect. Get that.
you are live. Go ahead, Clatsop.
Okay, thank you. This is Dawn. Our main focus has been fostering the relationships we started last year. There have been a lot of turnover with our local agencies, so making sure that everyone that works in each of them is on the same page with us and we all know what we're doing, and then also, of course, building new relationships. We've been meeting as a community partner group regularly for a working lunch. Like I said, we all share what we're working on and how we can help each other, refer to each other, and any events that we have coming up where we can share information with each other's clientele. Our reproductive health providers have been presenting to the local high school health classes each term. Prior, we've had a school bus actually bring the health class with permission from the parents to the health department so that we can see where we are and see the office and, you know, that it's not a scary place. And we seem to get a lot of new patients after we do that. So definitely want to start doing that again. We're trying to meet the community where they are. We've had informational booths at health and wellness fairs at our local community college, the Job Corps Center, a Homeless Connect event in Seaside. We've partnered with the local FQHC to hold an event at the Aquatic Center. And we just, in fact, yesterday got an email from the college inviting us to come back to their 3rd annual Health and Wellness Fair in April. We purchased a 10 by 10 canopy from Amazon and had a banner made with our name and started going to events which we've never done before. And we've used it at the Astoria Pride Parade and Block Party, the Astoria Regatta, and the Clatsop County Fair. We purchased condom kits, which we dispense at our booth with, and it has our contact information inside. There's a slide of that coming up. Our next steps are we always try to remind ourselves how far we've come, to have a continual presence on Facebook with informational, thought-provoking, conversation-starting posts. We're looking into sponsoring and volunteering at community events to get our name and faces out more. And our providers are starting to write reproductive health-related articles for free local monthly periodicals that are dispensed all throughout the county. The biggest, I might not be going in order here, the biggest challenge really is just finding the time with the staffing we have, and we appreciate the help with this. We're proud of the partnerships we've created, and with your help, the ability to be proactive as opposed to reactive, and just, having the time and the resources to reach out. So those are just a couple of the events, the regatta, the fair, and then the two on the bottom are the Pride, which was particularly successful, I thought, because every person that finished the walk of the parade came by our booth as they entered the block party, and I'd say 50% of them had absolutely no idea what we did, where we were, and there were people there that were 2 and 80. And these are the condom kits we purchased from ETR. You can get all kinds of designs. They have a scan barcode, so you can use your iPhone and get information on STDs. And then you open it up and there are instructions and a condom. And then we created that little sticker with the highlight with our name and our phone number to contact us for birth control and STD testing appointments. And I think that's it.
Excellent job.
Okay. Yeah, you are unmuted. And
No, Columbia. So it would be Mike Paul.
yeah.
Oh, it's
Yeah, she's on.
Oh, and Lilia.
I'm unable to unmute Mike.
Lilia, are you unmuted?
Lilia should be unmuted.
Lilia, you are unmuted. Hello? Okay. Well.
Yeah, his icon thing is gray, so I don't know.
So maybe you don't have access to a microphone mic. I don't know. You can use the text box if you need to communicate with us. Lilia, you are unmuted if you want to talk. No? Okay. So I just got off the phone with Mike earlier this week, and until he maybe can jump on, I know that Columbia County has done a lot of work. They have worked with Columbia Health Services. They're working to identify new agencies for certification, and really working on developing those strategic partnerships to improve access. And they're also going to conduct a local assessment, and they have done a lot of work to partner with multiple organizations on that. I know they've connected to OHSU and a few others. Access to care is an issue in this county. As you can see, it geographically spreads quite a bit. There's some data around population. I feel horrible, Mike, that you can't talk to us because I know you have great things to say. So they've really been working on expanding certification with some other clinics. They've done stakeholder interviews with providers and partners, and they've been working on a healthcare resource guide. One thing I know they're working on is they want to add a short survey to their STI investigations around access, which I think is brilliant. And again, as I mentioned before, they are partnering with OHSU for a formal report. They're gonna tap into students, which I also think is a brilliant idea, on gaps in access and barriers to care. I know some challenges that they're experiencing in Columbia County is that the entire county is considered medically underserved. And Mike was mentioning to us that even the major employers have Kaiser as their health insurance, yet there are no Kaiser providers within the county. So most everyone is having to leave to access care. Those are really interesting access issues. Transportation is very limited, and there's been transitions within local public health over the last several years, and so they're rebuilding their public health reputation in Columbia County. You're doing a great job, though, Columbia County, and Columbia County has some great questions on the questions document, the handout, if you want to check that out. I'm real sorry, Columbia, that we couldn't unmute you, but we'll move forward to Coos.
Okay, cool.
Florence. Good morning, Florence.
How are you?
Well, how are you?
I'm good. I'm good. You can move to the next slide. Okay, so I just wanted to give a quick background. So the first year of the grant, we convened a reproductive health collaborative that was made of school nurses and school representatives, the Department of Human Services, Juvenile Department, of course, Public Health, mental health folks, healthcare providers, school-based health center, and organizations that work with at-risk youth. And so what the collaborative decided to start with was to start with an assessment of what's going on in the community in terms of access to reproductive and sexual health. So you can move on to
Florence, if possible, can you speak up a little bit?
I'm like on my phone. I'm on my I'm gonna try to.
You're doing already better. Thank you.
Okay, good. So I'm gonna try to speak louder. Can you switch slide? So the next one, please. Okay, so what we did pretty much during the assessment is we conducted surveys and listening sessions, and we had about 400 responses from individuals of reproductive age for the survey, and then we talked to about 50 youth in focus group setting. And what we found out was that the knowledge about safe sex practices, pregnancy prevention, and STI prevention was really low. That the knowledge about existing services available to folks in the community was also pretty low, and that where people were going, especially the younger generation, to find information was not always reliable. Next slide. So what we also considered was kind of our local data. I know it's probably not news for anyone. STIs are our main burden of disease in Coos County, in communicable disease. And so we also have, the younger generation that carries quite a high proportion of the burden of disease, especially for chlamydia. So that helped us kind of make the case for possibly the need to do some outreach and education in a different way. Next slide. So what we decided to do is to create a website. And if you could click on the website image, that would be great. And so what this website is a inclusive educational tool targeted to the younger generation, but it's open to everyone, of course. It's based in the data that is put out there is, of course, evidence-based. It provides information about safe sex and how to prevent pregnancy and how to prevent the transmission of STIs. And if you go to the more category, you'll see that we also have interesting. Okay, so we have a link to the local clinics and how to get there. And we're going to develop a blog that will hopefully be fed by questions that people are going to ask us, and that we, of course, will found of relevance. So we're super proud of this tool. What we've done so far is that we've presented it to pediatricians as a tool for them to use with the teenagers they serve if those patients have any questions. I presented it last week to a meeting with all the superintendents in the community. So we're talking 7 or 8 school districts, and everybody was very excited about it. And they're thinking about possibly adopting it as a tool for their human sexuality curriculum for the kids. And so the next steps are we're going to continue promoting the website. We're currently designing little business cards with QR codes for the kids, and all this has been beta tested back to the youth, and really like we added a lot of content to the website, like around LGBTQ and what are, you know, we had some questions about, oh, what is the difference between sexual orientation and gender identity. So all this is in there. We have a lot of information about what makes healthy relationship. We're really trying to build this as a very broad and also holistic tool that people can use. So next step, we're going to just promote the website to whomever would like to listen to us in the community. And we are also developing an app, and so the app is developed. We're just in the process of loading it up on Google Play and iOS. Next slide. So possible challenges, so far we haven't had any, but you know, one, because I wrote this in December, was that possibly the superintendents would not be on board, but they seem to be on board with opening the website on school grounds so that the kids can access the content. We are anticipating maybe some community reaction to the website and the content, but we're ready to tackle it with data-driven conversation. And yeah, I had another point on the previous slide. Yeah. And yeah, so the other possible challenge is that the youth are not buying into the app or the website. And so, well, that hopefully won't work. Next slide. That won't happen, sorry. Next slide. So we're really proud of this work. I think it's kind of out of the box thinking a little bit, and the person we contracted with really did an amazing job at making sure that the website is appealing and that there are a lot of content, videos, and it's very youth friendly. So if anybody has any questions, you're welcome to contact me. I guess I put my cell phone number in there. Why not? And my email. Thank you.
Thank you, Florence. Great job. All right, we're going to move next to Crook.
Joanna, you are unmuted.
Joanna.
Good morning.
Good morning.
So for Crook County, the focus of our plan is build and strengthen community partners with current and new partners, and work with partners to find pop-up clinic sites, or maybe a van that we could use for pop-up clinics, so that we can move our clinic closer towards the high school, where people they have open campus lunch, but sometimes it's hard for them to get across town in the hour that they get, and they can't, if they don't have a car, they still can't get to us privately. We're also working to provide educational opportunities in general, and then also to populations at increased risk. So far, we have promoted services and the RH program to local primary care offices. I've been able to attend both of the local primary care offices provider meetings and talk about the program and what we offer. I have worked with Deschutes County, and they very graciously have taught me difficult IUS removal, so I don't have to send my patients out. And we're continuing to standardize care across neighboring clinics and counties. I cover in Jefferson County on Mondays, and so I'm continuing to work with them to standardize the care that Jefferson County patients are receiving with Crook County patients. Our next steps continue to reach out and build relationships. We taught a class in the high school this week to all of the freshman health classes, and we'll continue to do that for freshman classes and then also juniors. We are going to arrange classes with the juvenile department, some of the local recovery services as well. We would like to provide classes with their clientele. Challenges we might be facing: our county built a new jail,
So for the first time in a very long time, the jail actually has female residents in it, and the jail being built and all of their processes changing has been huge for them, so they haven't been able to engage in a whole bunch. The county has new mental health service providers, so historically we were using one, and then mid-year we have now switched to a different service. So the youth and adult transition drop-in center has closed, and we're not sure even if the location is going to change where the mental health services are being offered. Time and bandwidth, multiple priorities and demands. We love the community outreach and going out into the community, but for our small staff, that means blocking clinic time in order to do that. And pop-up clinics are not an easy thing to build from scratch, and funding for a van isn't just going to land on my desk. So, although I'd like it to, just trying to figure out where I can get funding and how we can do pop-up clinics and push the envelope without burning bridges. What are we most proud of? The care our clients receive. We try and put the clients first at all times. So if we have a high school student that calls and says they can only get there on their lunch break, we schedule their appointment during lunch, and we will move our clinic hours as needed, or our lunch hours as needed. We're having evening appointments once a month, and those have been well received. And we are in the same building, like a lot of other health departments are in the same building as WIC and maternal child health and OHP assistance. And so if we have someone that needs help in any of those areas, then we connect them prior to them ever leaving their appointment. And being able to meet the client's needs and add to their and the community's success. For us in the rural community, every unintended pregnancy we can prevent, and every teen pregnancy we can prevent and educate clients, it really ultimately positively affects generations down the road for our county, as you guys well know.
Thank you so much. Great job. And Curry County has had some recent staffing changes. And I talked to Lauren, who is the new PE 46 coordinator, who literally just started and thus has no slides. So no worries, Curry. We know that you are working hard. Deschutes, let's get you ready. Are they not on?
I don't know.
Pamela, can you type into the text box? Are you on? No? Okay. Well, if we don't have anyone from Deschutes, I am gonna, oh no, it's Ann Kilty.
Yes. Ann, you are on.
Ann, you're unmuted. I don't hear Ann. Here are Ann's slides. Ann, can you unmute yourself? We've unmuted you from this end. Okay, so we're going to move forward then. Deschutes County, they've had significant staff and structure changes, and I know that their PE 46 coordinator has changed. They now have a fabulous team of energetic women who are passionate about reproductive health. During the past 6 months, we focused on discrete goals that were achievable with limited staff, a few events, and initiating new partnerships. For 2020, the goals are to solidify and expand the partnerships that they started and to plan and execute increased outreach to teens, Latinos, and the houseless.
She says she's on, but she's unmuted on her end. She can hear us. Let me.
Can you guys hear me?
Yay!
I'm like, I'm here.
You're live. Go ahead. Let's go back. How about?
Okay. Thank you.
Yes.
Okay, great. And then if you could go to the next slide, that'd be fantastic. Okay, so as you were saying, Dolly, we have had some really significant
staff and clinic structure changes, longer than back towards July, but since we're just covering July, I said through July through November, but we now have a full staff load and some really amazing new additions of some great women who are really passionate about reproductive health, and we're very excited for the future. So during that time, we were really just able to do just a few projects because we were spread pretty thin. But we are having a retreat next month, and we are looking forward to setting our goals and expanding our partnerships and what our plan is for outreach. We particularly want to focus on teens who do not know about our services and are not engaged in any sort of reproductive health care. The Latino population, which, as was mentioned earlier, has kind of disengaged a little bit, I think, because of the political climate. So we want to kind of get back out there and reassure people. And then we, like most counties, have a significant houseless population, and how can we reach out to them? What's the best way to get them into clinic or get services if it's not in clinic? So our current work, we are trying to partner more with our behavioral health services. We share a building actually with the intensive youth services here in downtown Bend. So we're trying to partner more with them. There's some history of some difficult relationships there. I think I have a slide on that later. We are in the early stages of talking with the OSU Cascades campus about also starting a pop-up clinic, much like Joe is thinking about doing in Crook. And that, as Joe mentioned, there's a lot of challenges to starting a pop-up clinic. So we're working through how feasible that is. We have done some partnering with the Oregon Mothers Care, which is a regional tri-county perinatal care team here for Deschutes, Crook, and Jefferson counties. And then also, as Joe mentioned, we're doing some partnering with Crook and Jefferson. We were helping with difficult procedures. And then I'm doing their LEAPs and colpos for the patients that Joe is seeing in Crook and Jefferson, so that people can have access to that through the county, and also through, we're doing that through ScreenWise for people who don't have access financially otherwise. Our challenges, time, as everyone else says, time is a constant challenge, just being spread really thin. We're trying to determine the best way to increase RH services for the targeted populations I mentioned previously. And then I mentioned our retreat that we're having. So next slide, please. So one of the things that we did actually just back in November, which was a big event for us, is we, as I said, we share a building with what's called the DROP, which is part of the intensive youth services team. It's a open community space that is open to anyone 14 to 29 years old. They have a bunch of different services here. They have smart recovery. It's a queer space. They have different events they do, access to behavioral health services, assistance with finding housing, jobs, etc. So that space also serves as the waiting room for the clinic, and that has presented quite a few challenges over the past 3 years that we've been sharing this space. And so there's been some kind of relational difficulties between that staff and our staff, and we're trying to find a way to make it a benefit as opposed to a problem to share the space. So we organized a pizza night here in the space. We had food, drinks. We did kind of some fun introductions of the clinic team, talked about all the services that are available, let everyone walk through the clinic and touch everything they wanted to touch, talked about the programs that were available, had an open question and answer session, which was pretty fun and funny, and really just tried to make it make ourselves more available and less about the people behind the big door who get grumpy when people are being inappropriate in the waiting room. So that was really successful, and we're pretty excited about it. We're going to continue to have quarterly events with issue-specific presentations, which I think will be great. Thank you.
Thank you. Great job. Let's do Douglas next. Douglas.
Who is that? I don't have them on my.
Who is it? Christine? Who's on for Douglas? Can you type in the text box so that we can unmute you? I know that Douglas has had a lot going on. We'll go ahead and show their slides. No one's on to talk. So their plan this year is focusing on sharing out their data that they gathered. They did focus groups and a couple of surveys. And then they're working on joint marketing materials and how to access RH services in the county with Aviva Health. So what they've done, they've created presentations for partners on the data collected in 2019. They've presented to Douglas County Prenatal Task Force. What they're planning on next is they're going to meet with the leadership from Aviva Health to discuss joint marketing materials and continue to educate and reach out to schools, health fairs, and the general public. Challenges: Aviva Health is recently doing some rebranding from UCHC, and also capacity, which everyone has pretty much mentioned. What they're proud of, they've got positive feedback on the data they gathered in 2019. The public perception of the RH program and RH services in general is positive, which is a great thing. Great work, Douglas. All right, Grant County.
Sorry, I downloaded the registration list.
Jessica? I'm pretty sure.
All right, Jessica, you were unmuted. She says, "Hey, Dolly, I cannot talk."
Oh, Jessica, I'm sorry you can't talk. Okay, well, I'll read your slides as best I can, and your slides are one of my favorite slides. And I'll show you.
She had to find a new computer without a mic.
You can also call in, folks. I just want to remind you there is a 1-800 telephone number. That's actually how I communicate with all of you. I do not use my computer audio. But I'll go ahead and read your slides, Jessica, until you maybe can figure out. So the focus of their 2019-2020 plan was to continue RH clinical services, to work on outreach and marketing, media outreach, and improve their website. I wish that you could talk to us, Jessica, because I know that you're doing some very interesting work around vasectomy. And I know that there is another county, and I can't remember off the top of my head who you are, that was one of your questions, was about vasectomies. And so I want to point out to you now that Grant County has done some work on vasectomy. I'm sure it's amazing. I have no talking points, but you all have this visual, so you know that it's happening in Grant County. So Jessica. Crook also wants to know about vasectomies. So Grant and Crook, y'all should connect because you're on a vasectomy wavelength there.
Hi, Jessica, can you talk now?
Yes,
Yay,
I
Jessica.
can.
Yay!
I got kicked off from my other computer. So I was listening to you, sort of. You got onto mine already. But so you had the first part right. We have actually done a lot of research on hiring a media specialist or a communication specialist for the health department, along with all of community counseling solutions. We've done budgets. We proposed this all to the board of directors, and at this moment we're on hold, but we've put a lot of time and money into that. We've spent a lot of time on Coffee Time, which is our local radio. And I actually apparently am famous as of this morning. I have heard from about 20 people, "I heard you on the radio." So we are working on marketing, which we are not good at because it seems like it's something we forget to do or don't have the time to do like we should. And we would like to improve our website. And you can go to the next slide. So I'm really proud about us being able to continue to offer our services. We had a nurse practitioner that had literally just signed a 3-year contract like 5 weeks earlier leave. We didn't end up having any break in any of our services, but the nurse practitioner we have now is actually going to a training, I believe, in June or July, and part of that is to be able to do vasectomies. So that's what I'm really excited about.
Yeah, that's awesome. And you need to make sure to connect with Crook County because they are also interested in this topic. Thank you, Jessica. Okay, we're going to move to Harney. Jolene.
Okay.
Jolene.
Hi, I'm here.
Welcome.
Good morning. So the focus of our plan was to continue providing reproductive health services as a certified reproductive health program agency as well. We also have an attached RHC, and so that has provided some challenges as well as some benefits, and I'll get into that more later. Our second objective is to seek and sustain relationships within the community. So one of the first things that we did is, of course, to continue to provide reproductive health services in the community, but we also were able to sign a contract, a memorandum of agreement with the Paiute tribe. They lost their nurse practitioner that was going out there. She retired and contacted us back in October. And our nurse practitioner that works for the RHC and also does family planning here at the health department will start, excuse me, going out there next week. So she will be doing primary care mostly, but will also be offering reproductive health services at that site. So that is exciting. One of the downsides of being attached to the RHC is now that some of these providers are their primary care, it's lowered our numbers because they're being seen under primary care, excuse me, RHC, and no longer are doing family planning. Regardless, they're still getting the care, so it doesn't really matter to me where they get their care. So we're excited about that. Then I made contact with, I wanted to have more contact with several of the churches, 3 in particular, that are working with recovering individuals. And since I do work all across the different programs, I try to weave things through everything I do so that it works together. And so I'm doing work with the syringe exchange program as well as providing reproductive health education in the jail. And so it made sense for me to partner with these churches that are doing a recovery class. So I have worked with the Life Church leadership and the Nazarene Church leadership. They have come, we met last week or 2 weeks ago, and we're coming up with a survey. Those 2 leaders are very excited about the opportunity to find out about the reproductive health needs of their clients or their people in the recovery program, as well as their congregation at large. And so it'll be interesting to see what they come up with. I've pretty much taken a hands-off approach until we meet next time and ask them to come up with ideas on what people would like to hear about, what they'd like to learn about, and then we will be putting together some focus groups and then a survey and focus groups, and then after that we will talk about what the findings are and how we might have an impact on that. One of the things that I completed already was I went to the Crane Union High School, and it is a dormitory, live-in high school out about 30 miles from Burns, and there are children that live 2.5 hours from Burns, almost into Nevada, that are housed at the Crane dormitory, and they're there Monday through Friday, and then they go home on the weekends. And Crane has typically been a very conservative community, and I wasn't sure if they would be very welcoming, the teachers and the school. But it turns out that they just had a new superintendent or a new principal hired, and he actually taught my kids in high school. And so we already had a relationship, which made an open door. And I went out and did a reproductive health survey with those kids in the junior health class. And they will be getting into the sex education curriculum. At that point, they weren't, but we talked about 15 minutes about the survey, and then we spent the remaining hour about talking about everything else. And their surveys were interesting. The questions, I had an open-ended question at the end about just general health in teenagers and what were their concerns. And 4 of the 11 were very concerned about depression. And so after looking at all of the results, right after the Christmas break, I got in contact with the principal again and talked to him about the results and what my concerns were with that. And they're probably now going to be starting a youth teen mental health first aid training for all of their staff. And so that was not anything I anticipated as a result of this work, but still a really cool outcome from it. So the next thing will be to meet with the churches and develop the survey and then administer the survey to the focus group and then go forward from there deciding what we're going to do. The biggest challenges were time and staff because I'm it. I have a WIC lady, an OHA assister, and me. And so that has been hard, but we're powering through. And we also lost our 340B pricing, which was, I didn't get the application for the STD part, but the state has been very generous in helping us through that, and we should have that as of April. So that's pretty much all we have done.
Excellent. Thank you.
Thank you.
All right, we're going to do Hood, and Hood may be the last county that we do in today's webinar before we open it up the phone lines for questions. So I'm just going to throw that out there. Hood.
So Patricia is on, but I'm unable to unmute her.
Okay.
The same gray icon that.
So it looks like maybe, Patricia, you don't have access to a microphone. I don't know if you have the ability to call in.
I did just resend you the pin, the audio pin.
This beautiful picture of Hood River County. I will move through your slides until perhaps you can log on with us. So far, Hood River County Health Department has developed robust referral process with area providers for uninsured and underinsured women to receive LARCs. They met with One Community Health about becoming a C-care provider, particularly via school-based health centers. They partnered with the Next Door. Oh, hello.
Hello.
Yay.
Yay. Hi. Sorry. I
Hi.
just hung up and redialed in because I didn't have the audio pin number when I, so I don't know if you said anything.
I did, but start over.
Okay.
Your slide is up.
Okay, so I'm Trish Elliott from the Hood River County Health Department, and so we've been working on community participation work, and we have partnered with, in particular, our Providence Women's Clinic to develop a really strong referral process for uninsured and underinsured women. They send to us for LARCs, and it's been a great partnership, and that's been really good for us. and the clients. We've met with One Community Health, who is our medical sponsor for our school-based health center, about becoming a C-Care provider. Right now, they're providing comprehensive services, but for those students who don't have or aren't using their insurance, they're taking a loss on all of their supplies and their time. And so far they've been a little resistant because they've had some turnover, and I think they see the paperwork and the rules as a barrier. But I know that they lost about $40,000 last year by not billing for services. So we're going to continue to work with them. We've partnered with the Next Door as a referral source for their Hispanic outreach for HPV vaccine. And they're continuing to do that work. We provide regular reporting to the boards of our CCO, the Clinical Advisory Panel, and the Consumer Advisory Council, and we do that on a regular basis. We also, a couple of things that were left off of this list is we have provided quite a bit of outreach to Columbia Gorge Community College in Hood River, the Hood River campus, through condom distribution with condom boxes, clinical information. We also have an OHP sister and STEPS coordinator who is at the college, and she does a lot of outreach while she's there and refers to our services. We're also providing reproductive health services at the regional jail in conjunction with North Central Public Health District because we share a clinician. And we also attend the warming shelter on a regular basis for outreach, education, referral services, and we do a monthly radio program. So the challenge has been getting providers interested in talking about reproductive health program, a lack of bicultural, bilingual licensed staff. We have a lot of Spanish-speaking only clients, and we have to use an interpreter. Unfortunately, our bilingual nurses are snatched up by higher paying entities than public health. So, and then participation in all of the PE 46 calls just because of our short-staffed, the nature of our work here. So the next steps are to continue to engage with the partners that we've already worked with, and we are also exploring a partnership with DHS Addiction Services to provide clinical services for some of their clients as well. We're continuing to update the CCO partners and work with the Eastern Oregon Modernization Collaborative around regional diversity, equity, and inclusion work groups and trainings. So we had staff that attended the sexual orientation, gender identity training in La Grande, and it was an amazing training, and they brought back lots of information, and we have undertaken those changes, and now we have gender neutral signage in for the restrooms. We've updated all of our reproductive health forms for the health department for the county to be more culturally and gender inclusive. We've also stood up a health equity work group that meets monthly and participates in the Columbia Gorge Regional Health Equity Team. Our chairperson for that meeting attends the regional meeting as well. We've painted inside and out the building. If any of you have ever seen the outside of our building, it was pretty much a patchwork of different colors from different eras, and now it's all uniform. It looks great, much more inviting, and a much more welcoming environment inside. and what we want to know or what other LPHAs are doing. And I really appreciate the presentations I've seen. And how can we involve more staff in PE 46 webinars? It would be great if we could figure out how to get staff free to be able to sit in on these calls. And that's it.
Thank you so much. So I'm going to pause here for just a quick second. We have 15 minutes left. We would like to invite folks to ask questions. If you would like to type a question in the question box, we can unmute you and allow you to ask questions of the counties that have presented thus far. I'm going to also fast forward to our questions. You all have them as an attachment, remember, just to see what the questions were at the beginning of the webinar that LPHAs had of you.
So, should I read the one question?
Yes, please read the question that you have.
Ann Walker would like to hear more about the pop-up clinic and how that might work.
So if you...
Crook, so I think that was Joe.
Joe, can we ask that you speak a little about pop-up clinics? Allison is going to unmute you.
Okay, you are unmuted.
Joe.
So I can tell you what I envision in my head. And what I would like to have is a spot, or even if it's just a little building or a mobile van, that every so often we can drive to someplace in the community and put one of the big banners out, contraceptive clinic, come on in, or something to that effect. And we would be able to have our equipment and supplies on hand to collect screening and then essentially perform clinic right out of the off-site facility, because really all we need is a laptop for charting and then our basic vital sign stuff, and we're good to go. So all of it would happen off-site. The fairgrounds here in Kirk County neighbor the high school property. We cannot be on school property and dispensing condoms or birth control, but we can be right off of school property on the fairgrounds, and kids could just walk over if they wanted to. We have talked about kind of privacy issues with that, and my thought would be if we found some place that was kind of towards the back, or put up some privacy screens out front, maybe with some bamboo or something, that we could provide those services. Is that what you were asking?
So there was one follow-up question. Does the Board of Pharmacy allow for pop-up clinics where you are dispensing BC?
I would have to look into that. My thought would be it's no different. So we currently have our maternal child health nurse off of the standing orders or protocols, whatever the politically correct term is nowadays. We have packed up like kits for her, where if she has a home visiting client that would like to start on contraception but can't get into the clinic, that she will do a quick start in the home. So I view it as really no different than that. I worked hospice for a while, and so I don't know, I haven't checked with the Board of Pharmacy, but I don't know why, if we're not storing the meds in the facility, if they come back to our facility and if they're locked, I don't know necessarily why that would be different.
Go ahead.
Okay, so we have another question from Amber from Yamhill is wondering if Clackamas can share out the types of organizations participating in your collaborative.
Lindsay is probably it, because I'm assuming Kim has gone off the line by now.
Kim is gone. Lindsay is on, but I can't unmute her.
Okay, so Lindsay, we aren't able to unmute you. But as it turns out, I have participated in the Clackamas Collaborative on a number of occasions and can give you an example of who's there. I know they have the Women's Resource or like Sexual Assault Coalition, and I'm sure these names are not all the way accurate. They have their FQHCs, so Virginia Garcia Neighborhood Health Center. They have their FQHCs through Clackamas, so like Beaver Creek, and I can't remember what the other one is. As they mentioned, they had a school board member on, and I'm sure that she's helped to influence some of the decisions that happened with the school board. They have Planned Parenthood present. They have representatives from the school-based health centers. There's WIC. I was impressed with the number of other public health entities that participate in their coalition. There was like immunization, WIC, maternal child health, STI, like a bunch of EPI people. And more, I think that's something that's really interesting. Both Clackamas and Washington did this. It's all connected to their CHIP and their SHIP. And so they have all of this other buy-in, and thus there's other kind of people who are dealing with access in other parts of the health department that are also accountable to the coalition. And so that's a really rough outline, but I felt like there was a really wide representation. There was people working with houseless community, 211 is there, all sorts of Latinx serving organizations are present there. Lindsay, I hope I did you proud.
Joe from Crook would asked if someone could email information about the vasectomy training. She says, I would love to do this and just found out yesterday that the last provider in our county that offers them is retiring at the end of next month. Wow. So whoever has that information.
Jessica, I think, could you email me your vasectomy? Can you hook it up with the vasectomy info, please? So the slide, yep, go ahead. Nope, go ahead. You have the questions.
So Lindsay, back to the question about organizations participating in the Clackamas Collaborative, also said 211, Neighborhood Health, and Youth Era.
Cool. There's lots of different faces. All right, so you can continue to type questions into the question box. We will unmute you. This slide you're looking at now, I created these so that you all could see where questions were coming from. If you wrote a question and you don't see it, it's likely that I'm going to email you directly to address your question. These are the first slide of questions that came out from you all, and I'm hoping that you will see these and that you will reach out to each other. After this webinar, will send a contact list out so that you have each other's phone numbers and email addresses, and you can follow up and say, that was a great idea. How can I do that in my community?
Ann Kilty has a suggestion. She says, looking through the questions, many people are wondering about marketing. I think public health agencies in general are not used to the idea of marketing. It would be great to have some focus on successes and ideas around this topic. I feel like community partners are easier to connect with than the actual people who need the services.
Great idea. Maybe that's a future webinar topic. I love it. We can work on doing that for you. That's the last question. Okay. So we have about, 6 minutes left? Oh, no. And oh, okay. So I'm going to go back up. Let's see if we can get one more presentation in. Who would be after Jackson we're at? All right. And I know that we didn't get everybody, and I'm feeling awful about that. I know that schedules are hard, so hopefully we can make up February meeting. I will go ahead and send out a calendar invite. Stacy, are you on? Do you want to take the last 6 minutes to present on Jackson County.
Stacey, you were unmuted.
Sure. Can you hear me?
We can hear you.
Okay. So the focus of our PE6 work, I'm Stacey, I'm the public health clinic manager here in Jackson County. You can go to the next slide. Our focus of our PE46 work this half of the year was to ensure access and transition our clients from our reproductive health clinic to other providers in the community. We also participate in our health equities, reproductive sexual health equity work group, and then we also participate in a work group to support LGBTQ+ patients. So next slide. So in July of 2019, we actually, due to budget constraints and declining encounters in our clinic, we decided to close our reproductive health and STI clinic here in Jackson County. And so a lot of the work was behind the scenes, meeting with our local reproductive health program providers in the area. So that was La Clinica, Road Community Health, and Planned Parenthood of Southern Oregon, to discuss capacity, their willingness to absorb our clients, and then also how to best serve those clients by getting them over to those organizations for services. We also, discussed how we were going to notify clients, how we were going to notify the community, those kinds of things. So that's really kind of what a lot of our work focused on. Also, just really focusing on our clients and making sure that they continued on with their services and had their contraceptive issues addressed. So a lot of the work was basically getting in touch with those clients, phone calls, letters, doing postings on Facebook and our website, doing media interviews, newspaper interviews, going on the news, that kind of stuff. And then we also participated in some community events and forums to also get the word out. Some of the challenges, most of them were kind of internal, although we did have some external challenges as well. Obviously, it was extremely emotional and sad for staff here. We have staff that is so dedicated and passionate about reproductive health, and so to discontinue those services was just, it was heartbreaking on so many different levels. So, there was that challenge. There was the challenge of finding places for staff, having them reassigned within HHS so that nobody was laid off. And then obviously breaking those relationships with our clients that had been with us for even many generations. But, we also saw opportunities in this transition. We have great relationships with our reproductive health partners. My staff and the community members were willing to take on the challenge of rehousing our clients. It really opened my staff up to be doing other work that we are required to do through our IGAs and our PEs. And then I really think that one of the strengths and one of the amazing things is that I want to speak to is just, the professionalism, the empathy, and the willingness of my staff to go out of their way to really meet our clients where they were and do really the best thing that they could possibly do for them. So that was one of the strengths. So the other piece of work that we work on, or that I work on, is the Reproductive and Sexual Health Equity Work Group. Our Regional Health Equity Coalition actually kind of holds this group, does a lot of the administrative work. And so we focus on the needs and experiences of people of color, LGBTQ+, people living with disabilities, low income, houseless, homeless, the people in our communities that experience disparities. And so what the group does, we have community members, we have community organizations, and we work to increase knowledge and understanding of reproductive and sexual health equity and access in Jackson and Josephine County. We work off of a work plan, we have a charter, we hold meetings monthly, and then we also have community events. So this is a picture of a community event that we did just in December. We had dinner, it was in the evening, and basically I'm doing an activity based on the social ecological model, where we're getting people to think about how reproductive health, sexual health equity can be addressed individually as well as on a community and organizational, and then on a policy level. So getting input and that kind of thing. So, and then the other group that the other group that I participate very peripherally on is our LGBTQ plus work group. We held our first annual summit last year, and then this year we are sponsoring 4 lectures. So we're holding a lecture series, and then you can see over on the right side some of the topics that are there in there for healthcare providers, from office assistants, front offices, to healthcare assistants, nurses, all the way up to providers, doctors, and managers. Okay.
Great
really
job. That was amazing. So great. So what I want to just say is that we will pick things up next week. I do have some time available now. We can stay on the line for a little bit for those that have the time and would like to continue a conversation and ask questions of each other. I will send out a follow-up email with the questions, contact information, and then if you did not present today, you can expect to present in February for our February PE46 webinar, which will be a continuation of this one. So I will send a follow-up email with all of that information. We have a question.
Charlie just asking if we can confirm the next roundtable debate.
The next roundtable will be, the date will be, let me get my calendar out. The date will be where's February?
The 28th?
It's going to be the 21st.
The 21st, okay.
I think. I don't have access to my calendar right now, sorry. No, it's not the week I'm on vacation. I'm back from vacation. So I promise that within the next hour, thank you, it's the 28th.
And will you be expanding it for 90 minutes?
Yes, I will have to. It'll be from 9 to 10:30. I think right now it's scheduled until 10. Or we could do a 2-hour. How do you feel about a 2-hour last recap, y'all? Can you type in the question box? I try to make it easy for you. For those of you that have asked about how can I get my staff involved in PE46 website or webinars, I want to let you know that PE46 webinars happen monthly on Fridays. We record them because I know that there are people that don't work on Fridays or don't have capacity to do this on Fridays. If that's the case, we understand. And you can share these webinars with your staff after the fact. So we will record part 1. It's recorded. We'll add it to our website so folks can go back and examine it after.
We have one person who says they can do 2, one person that says they are not able to do 2 but can do 1.5, one person says 2 hours is too long, one person says I think we'll need to get through 2 hours, and they can do it. 2 go.
Okay, so what we're going to do, because everyone has different needs, is I'm going to schedule 90 minutes, and I will be available for 2 hours. And so if you have the capacity to stay on longer, we can extend the conversation in the next webinar. Within the next hour, I will send a follow-up email with everything I just told you and anything I promised you, because I try to keep my word. You all have been awesome. As a reminder, our website is here. And thank you for doing what I asked. Literally, this is why it's become hard, is because everyone did what I asked, and I honestly wasn't expecting that. So, so that's why you've made my job harder, and I've got to make a second webinar. You have so much to share. You're doing great work, and I want to remind you that I love not being at my desk. And if you invite me, I will come. All right. Have a happy Friday. Any last questions? All right, we're ending this. Have a wonderful weekend, everyone.